So appreciate your energy and look forward to continuing the discussion today. First, I wanted to recognize Representative Phipps, who is the chair of the Aging Committee. He is here. I don't know if he's, I know he's got a pretty busy schedule, so I appreciate him listening in today. If he's available, if you'd like to make some remarks. I think he might be tied up with something else as well. My co-chairs, Representative McCarty, is going to be here momentarily. She has an educational meeting happening at the same time, and she wanted to attend both. And then Representative Comey is also going to be in and out today because she has multiple meetings. I know we're not on our normal cadence with the holidays of being the fourth Thursday of the month. But really wanted to say thank you to join, especially today, because it's one of these, busy times of the year and everybody has a lot going on. So with that, I think we should just go ahead and kick off. I will let the co-chairs make comments when they come back. But I thought I would start with the review of the November 18th meeting. You hopefully all received the summary that was sent to you, along with the community healthcare and hospice consent agreement that was also sent. Just wanted to double check with anybody if they had any questions or any follow-up from either of those two things before we jump in to the next part of our discussion. Okay, seeing none. Jennifer Cavallero has been kind to forward some information regarding the investigations. Jennifer, I'm going to put you on the spot, and I was hoping that you could report to the group what you were able to find as part of your follow-up. And thank you in advance for sharing that along with us.
Yes, thank you so much, Representative Dathan. I apologize. It took a little time to get the information from the Department of Consumer Protection. So they are responsible for homemaker and companion agencies, which register merely with the Department of Consumer Protection. So I did talk with their Director of Investigations to find out, number one, how many complaints had they received in 2020, which was, they had about 120 complaints. There are approximately 800 homemaker and companion registered agencies in the state. The complaints were related to billing concerns, service issues, and allegations of misconduct. Their process is when they receive a complaint, they do go out on site and investigate and do an audit of records. And then depending upon what they do find, they will make referrals to appropriate agencies, whether it's local law enforcement. They do make referrals to the Department of Public Health, Protective Services for the Elderly, Department of Social Services, and certainly can, make recommendations, based upon, enforcement in terms of their registration. Obviously, it's not licensure, so making recommendations that the agency no longer be registered with the state of Connecticut. And we continue to have our monthly work group with the Department of Consumer Protection at the Department of Social Services. So we meet monthly with Allied, which is the fiscal intermediary and the credentialing agency for these homemaker and companion agencies. The Department of Consumer Protection is there, and those of us in Community Options. So we've had a good work group in being able to hopefully begin to identify, some of these provider issues in advance of them actually occurring.
Wonderful. Thank you so much. That's really helpful. Does anyone have any questions for Jennifer before we jump into the next thing? Diane.
Yes, good morning, everyone. Thank you, Jennifer. I wanted to know, how do these providers or the Department of Consumer Protection, how do they tell the public that this is a pathway for a complaint, to file a complaint? Because of course we know if the data only says as much as the public is aware of the fact that the Department of Consumer Protection is one of the tools in the toolbox. So I'm not sure that, how can we be more confident in these numbers? It's great that there seems to be a process to meet monthly and it's preventive. That's great. But one of the things I ran into, I'm kind of like the citizen representative on here, is that it's very difficult to know who to talk with. And I know Representative Dathan's, one of her goals is, I believe, is to make sure the public understands the process. So could you comment on that, please? Thank you.
Yes, and I certainly could recognize that as an area of concern, because there are so many, state entities, and certainly knowing which is the right outlet in terms of if you have a concern or a complaint. The Department of Consumer Protection certainly on their website indicates that you can make a concern, as well as the agency is also supposed to indicate where complaints and concerns can be made. That is one of their responsibilities as a provider. And certainly also through the waiver, those that are participating in home and community-based service waivers, those clients are also to be advised under their rights and responsibilities that they can make a complaint to the Department of Consumer Protection, as well as through their access agency and the Department of Social Services. So there are several routes in terms of making a complaint or a concern with their service. But I certainly agree that we can never put enough information out there in terms of, a pathway to indicating that there's a concern.
I'm sorry, Representative Dathan, may I just follow up quickly? I didn't understand what the waiver that you mentioned, that it seems like maybe that's I don't understand that part of the system where there's a waiver, and why would that make it different from any other?
So I'm so sorry. So you have the certain programs that fund some of the providers. So these homemaker and companion agencies may be receiving funding through Medicaid waiver programs, such as the Connecticut Home Care Program for Elders or the Personal Care Attendant waiver. So if they are participating in one of our waivers that are managed by the Department of Social Services through those individual programs, they also have rights and responsibilities. So not only do they have responsibilities through the Department of Consumer Protection that they registered with, but they also, as a provider under Medicaid and these Medicaid waiver programs, they also have responsibilities under that as well.
Great. Diane, do you have anything else?
No, I'll do some homework. I didn't know about the waiver process, so thank you very much.
Okay, wonderful.
No, and I'd be happy to share further information with you, Diane. My email, Heather can share my email, and I could direct you to where our information is shared about the various waiver programs that we have, because there's quite a few.
That's awesome. Thank you so much, Jennifer. Really useful. I see Dorian has her hand raised. Good morning, Dorian.
Good morning, everyone. I just wanted to point out, because there are, sometimes challenges in folks knowing to whom they should report concerns that they have. So there are a number of resources. We talked about consumer protection and public health, but the Attorney General's office also has because many of the folks that we're talking about are elders, has a elder justice hotline that's available to consumers. And they really are great at routing folks to the appropriate entity. And Jennifer, you raised a great point that, those of us that are in the role of kind of ensuring that folks are protected, we communicate greatly, all the time. But the elder hotline is available at 1-860-808-5555. But that's a resource through the Office of the Attorney General that's quite helpful and would be a great place for folks to route and get appropriate information if they're not sure where to go. So I just wanted to share that resource.
That's great, Dorian. I know there was a little bit of press on that this autumn, and I think we just need to continue. I think, we've talked a little bit about the group that, we have a lot of these resources within Connecticut government. The problem is that people don't always know about them. And so communication and dissemination of information is probably one of our biggest challenges. And we need to make sure that we do a great job in educating the public and letting them know what's available and what's not. So thank you for bringing that up. And there is, I know Representative Phipps is also involved in a elder fraud task force. And there's a few other folks involved with that. And I'm sure, there's so many aspects to that, but that's beyond our working group for today, but it is important to have all of that information. So thank you. Mairead had her hand up, and I'm sorry if I was going on so much, but if you'd like, do you still have a question?
I just wanted to thank Dorian for bringing that up, because we hear that all the time, that people don't know where to call, and we are really trying to stream people to that one source so that we get, because we're collecting data on that. The Attorney General's office is actually collecting what kind of calls come through, what didn't they know, so that will help inform how we get information out better. People could direct people that way. Thanks, Dorian. I think it's important for us to know where the gaps are.
Yes, exactly. The interesting thing is, we do have the internet at our fingertips and ability to search things, and it's just ability of finding information is a little seems almost more challenging than it was before our digital age, but I digress. I think that's great. Just going to welcome Representative Kathleen Mccarty, who's joined. I mentioned to the group that you've had multiple meetings going on, so we really appreciate your time and involvement this morning. Do you want to say a quick few words before we've just done a summary of the last meeting, and Jennifer's given some information on the complaint and investigation process.
Yeah, good morning, everyone, and thank you, Chairman Dathan. I do apologize. It's the difficulty of trying to be in two places at once this morning. So I do appreciate it. And if I may, I thank everyone. I think this is such an important working group, and I'm looking forward to the discussion today on the direction that we will be taking going forward. And just like to thank you, Chairman Dathan, for supplying all the materials. I did read through the summary, and sometimes when you go through it, you say, oh, we said all of that. So it really refreshes the memory, and you can see the work that's being done by this group. So thank you very much, and I'm looking forward to the discussion today.
Of course, it is indicative how wonderful you are that you are wanting to be in, that people want you in multiple places at one time. So thank you for choosing to spend some of your time with us this morning. It really means a lot to me and this group as a whole. Melissa Morton, you have your hand raised.
Yes, thank you so much. I just wanted to circle back to the comments about people not knowing where to turn and what's available to them. And I think one of our strengths as a state might be that we look for ways to create programs, pass legislation, do things to patch holes and gaps, but we don't tend to allow for any administrative funding for promotion of these wonderful programs that we are putting together. So a lot of times funding is very restricted in state government to certain purposes. And a lot of times the outreach is what falls off. So we have just enough money to get staff and get things up and running, and then we have no way to promote it. And I would also add that another area where that can be an issue is having the funding and the resources for the ongoing monitoring and evaluation of our successes and our challenges. So I think that we're great at the getting up and going, and not so good at the making sure people know what we're doing.
I think that is super important point. Thank you, Melissa, for bringing that up. That's something that we've kind of touched upon in the past, and I'd like to say that as part of our discussion this morning, because I do think that that is an important thing when we talk about this group and what we're trying to achieve. So stay tuned for a few more minutes and we will continue to have that conversation. But I do think that that is an important point. If there's no other points, I'm just going to jump into the main part of the agenda. Great. Well, the main part of the agenda, we're, just continuing the discussion of the possible legislative proposal to add our community hospice ombudsman services. And I wanted to start the discussion today really reminding folks that there is statutory language both here in Connecticut, but also at the federal level, that where terms are defined and our funding is tied to this sort of language that our statutes have. So, for example, long-term care is defined at the federal level, and there is funding tied with it. Same thing with the ombudsman role. And if we start changing this up, it can, one, add confusion to what we're trying to do, but second, it also could put at risk some of the funding that we have tied to this. As Melissa pointed out, clearly an ombudsman is well, she didn't say this, but she's talking about the education piece, but the the ombudsman is, a support person, not someone who does the licensure. It's really to support our community. And we need to remember that. And I think we need to do a better job, like Melissa pointed out, as a state to make sure that that's what folks know, because we need to understand that it's not someone who handles all of the complaints and does all that. That's part of the process, but not all of the process. And just along those lines, we talked about at the last meeting, the verbiage of the LTC to LTSS, the long-term services and supports, and the federal verbiage is going towards that direction. So just to kind of remind folks of that as well. And we had some great discussions in the last meeting about ensuring that we want to make sure that we have a good all-encompassing community-based care program, including home health, home care, any sort of other things, not just hospice. And I do think that that's important. And we want to make sure, and everybody on this call really wants to make sure that no one is left behind. But I do also realize that we're coming up to a short session. I do think that there are limitations within that session, and then we need to be kind of thinking about how we can make a program successful, whether it's we just continuing to look at it and study it, or if we look at maybe an incremental sort of phased in approach. And I'm kind of leaning towards the discussion of a phased in approach and looking at what we're doing. And our current ombudsman program within the ADS, Department of Aging and Disability, has, the one in Marie's department where she's investigating complaints at a long-term care facility. But we do need to be thinking about the home health and the hospice care. And I think that's really what the work group, kind of set off to do, and make sure that we continue to go down that road. But saying that, I do think that we need to be thinking about what's going on in terms of other parts of the community, so that no one falls through the cracks. The key part of all of this is funding. And so one of the things we talked about in the last meeting was, different funding mechanisms. I've reached out to the various supports within, the Office of Fiscal Analysis and Legislative Office, and found out a little bit more about some other funding opportunities. One of the things that we talked about was potential ARPA dollars being able to help support this. because that would really help facilitate it. But the difficulty is those funds do need to be spent between April 2021 and the end of March 2022 for 1 year. And we're not sure if it's going to be extended or not at this stage. But those dollars also don't say that you necessarily have to have a community ombudsman program or how that would be fit in. But there is other opportunities of funding pockets that we've talked about in the past. And I think, there's still opportunity there. I wanted to pause for a second and find out if Mairead, if you have any more information on some of the funding opportunities that we've talked about in the past.
Thank you, Representative. So, as I'm sure everyone knows, Build Back Better has not been passed yet, although we're waiting. The community ombudsman piece under home and community-based services is still in place. And the funding for that is still there. I've talked with our representatives at a federal level. It looks like that is going to stay in at this point, knock on wood. We had the Home and Community-Based Service National Conference last week in Baltimore, which I did attend. And this and the settings rule were actively discussed. And so ACL, which is the Administration for Community Living, which oversees my office federally, is really looking at how they would move this forward. If it continues to stay in Build Back Better, we will get guidance from ACL on how they want to see this move forward at a community level. It sounds like, and again, still everything is in the planning phases, that it would be to support individuals receiving long-term services and supports. So to your point, Representative, keeping with the language, they're really trying to frame things in that way. They had discussions. We had another meeting about this yesterday federally, with ACL and Consumer Voice. I'm just looking at who was running the meeting. And some of the examples were from Wisconsin, Heather Bremer, who is the state ombudsman there and already does cover all LTSS wherever the person, they're following that model of you support the person where they're choosing to receive those supports. So Wisconsin already does that, and Washington, D.C. So Mark Miller, who is, and I know it's not a state, it's a little bit smaller, but Washington, D.C. does that, where if the person is on LTSS, they support them wherever they're receiving that service. So I have asked them for more information. They said that they would be willing to talk to a smaller subgroup from here if there were questions, if we wanted to tease out some of the information. But it did sound like that was kind of where ACL was leaning, because as you're pointing out, the larger universe of all home care, what does that mean? Does that sort of dilute what we're able to do? Would that be a place to start, kind of like we did with MFP, and then grow if it's shown to have an impact? I believe that that's where they're leaning, to start in that way, see how it goes, how are the dollars used, how many cases do we get, and then if and when appropriate, make the assessment and move from there.
That's super helpful. I think that makes a lot of sense. Does anybody have any questions or, Tracy Bodach?
Thank you, Representative Dathan. Mairead, great information. I had been keeping up with Build Back Better as well, and the community ombudsman piece. I like what you just said. It makes great sense. It does not include all of the players in the community. As you know, it would not include what we call on our home health and hospice side, the post-acute care settings and providers. So those that, may be transitioning from the hospital home, needing some short-term post-acute care, hospice, terminal care, et cetera. And I know that's what Diane, really has been so focused on because of your unfortunate experience. but I think doing what you're recommending, Mairead, would be a great step. And then the other piece, if they are presenting, Wisconsin or whoever might be presenting to a smaller group, if I'm not part of that, I would appreciate getting any information, which I'm assuming, Mairead, you would be right on top of, for numbers of staff needed per LTSS clients. How are they, what's the productivity abilities? And granted, Wisconsin's a much larger state to get across, but how do they do it? What are the gaps, the challenges, and what's been going really well? And those would be the things that I'd want to know. Thank you.
That's great. Thank you. Marie, do you want to respond to that at all before I let Diane ask her questions?
Sure. So to Tracy's point, that is something that came up, like the universe and who is served. So hospice did come up if the person is receiving LTSS services. So so their point that ACL was trying to make was that the support wouldn't be by service, it would be by individual, their needs, and where they sat within the system. So it's a systems related, right? So anybody on LTSS, there's a lot of people who receive long-term services and supports and elect a hospice benefit. So we wouldn't be supporting the benefit, we'd be supporting the person and where they're at. And it's kind of a reframe of our thinking and how we apply things, because a lot of times we do it by service, right, is how we set up. And federally, they're really moving towards supporting individuals where they are and what they're choosing. So yes, it would still support hospice, it would support really anybody who was having LTSS supports, even younger adults. So when you think about individuals who receive long-term services and supports, it's not really based on age, it's not based on diagnosis, it's based on support needs.
And I know many programs that we do within the state are money follows the person, and I think that's an important thing to be considering here. Diane, do you want to ask a question?
Just very briefly, very interesting. Thank you, Mairead, for clarifying that hospice did come up. That was going to be one of my questions in the conference in Maryland. Would love to have a link to that conference. I'd love to look over their agenda and see if there's any way to, I don't know if they recorded any of the discussions, but it sounds like it might be very helpful. The first thing is that I want to make sure that hospice care does and could be included. It sounds like it's a possibility, but again, I asked the question, when I know folks in the service, the providers on this call, when you say long-term services and supports, is there a definition as to how many months for someone to qualify as a patient in order to receive the benefit? Number two, while I have hopes and prayers that Build Back Better is passed sooner rather than later, if it is not, and we're starting a new year, what are some other possible funds available other than this Build Back Better? And have we looked at ways of, I know since there's, I don't think a lot of enforcement, but there are other ways of funding specific programs. So in order to try to keep the hospice part alive, including money, and I very much agree with the person that spoke about making sure we have money for promoting the marketing piece. Is there, I wanted to know, is when the Department of Health actually registers the providers, is that for free or do they have to pay a fee? Because what's traditional in the zoning world and land use and the local level, sometimes the fees are increased slightly in order to accommodate staff or a program. And that is something that I don't think we've covered as to whether there is a fee for the providers. I know that Tracy's eyebrows will raise, but the thing is, I really don't know if there is a fee in applying for registration with the Department of Health for the providers. So
I don't know the answer to that. I'm just looking for somebody who might know the answer to that. Oh, Tracy does know the answer. Tracy, would you mind jumping in there?
Sure. I just want to make sure I understand the question. So the home health providers, the medical providers, and the hospice providers are both licensed through the Department of Public Health. And yes, they have a fee for that and a fee for their Medicare certification. And then the homemaker companion agencies who are providing PCAs, homemakers, companions, live-ins, are registered with the Department of Consumer Protection, and they have a fee that goes along with that registration as well. And then those that participate, I should, and Jennifer probably can chime in on this, but those that participate in any of the waiver programs that Jennifer was speaking about before also have to enroll through the intermediary that ultimately pays them. But I don't believe, is there a fee to enroll in that, Jennifer? I'm not sure.
No,
I
there's
know there's QA oversight,
Right.
but
yes, there's not a fee associated with that.
Yeah.
No.
Okay, great. Hopefully.
And Representative, may I
Yeah,
answer the
please.
question regarding LTSS?
Yes, that would be great. Thank you.
So Diane, there's not a, and Jennifer, jump in here at any point. So if someone is determined to need long-term services and supports, it means that they meet that level of care, right? So they have a need for assistance with bathing, dressing, toileting, feeding, transferring. Traditionally, years ago, if someone was on Medicaid, they really only had the choice to go to a nursing home to receive those long-term services and supports. Our state has done a lot of work around the waivers where Jennifer works on community first choice. We had Money Follows the Person that allowed individuals the option to choose where they received those long-term services and supports, because we thought it was a biased system where people with money could choose to have them in the community. People without money had to get them in a nursing home. There's been a big push nationally to allow for that choice. And so that's where we're saying, and just like hospice, just like any service where a person can choose to receive that in any of those settings, same thing with that title of getting their long-term services and supports. As long as the person continues to qualify in needing those services, so there's a physical qualification and a financial qualification where if they inherited a whole bunch of money, they probably wouldn't, unless they did other things, but for the most part, if they had funds, they wouldn't qualify financially for that support. As long as they qualify, continue to qualify for the physical need and the financial need together, and there's an assessment done annually, that they would continue to have that title or that overarching definition, and then would have access to that support.
Great, that makes a lot of sense. I hope that clarifies things. Melissa, I see that you have your hand raised. Actually, Jennifer, did you want to jump in with something else?
Oh, no, I'm all set. Thank you.
Okay. Melissa?
Yes. Thank you. I hope you can hear me. I'm having some connectivity issues. Thank you.
We can hear you wonderfully. Thank you.
Great. Okay. Marie, when you were talking about before, and I'm sorry if I missed it due to my technical problems, but when you were talking about that, they were talking about coverage, hospice being included in just long-term services and supports in terms of whoever needed the ombudsman. Would that also include if someone, would they be counting just receiving the hospice service as a long-term services and support, or would it have to be that they're
part of the long-term services and support system, and then hospice was something they were transitioning to or going to start using.
Yes, so the person would have to have, so if we went that route,
Yeah.
person would have to qualify for a long-term services and support need. And then, either be on hospice or on hospice and qualify either way. Instead of like, if you're on hospice, you automatically qualify, or depending on how our state did that automatically make them at that threshold other than the financial piece. And that would have to be an individual decision. I don't know. But in the models that I had looked at, it was that they qualified and then had that benefit.
So they qualified for a public long-term services and supports program?
For LTSS. I know that's the way it's done in DC, but we can certainly ask Heather when we talk with her. With Wisconsin, we had more of a short conversation about that and how they do it regionally, but we can certainly ask that and tease that out a little more.
Great, thank you.
And I do also think that Tracy Woodach wanted to weigh in on this as well. If you could go ahead, Tracy.
Yeah, thank you, Representative Dathan. I just wanted to share, what Mairead said is accurate, but just the usual situation that we see. Many times someone has been in the community and they've wanted to stay in the community. So they've already qualified previously for one of the waivers under the Connecticut Home Care Program for elders, whatever they're getting. They've already been in the system. So as they start to move toward terminal stages of their illness, that's when hospice would be referred. So it would be someone that usually is already on long-term services and supports, and then they transition. Occasionally, that happens at the same time because they were never picked up in the system, as eligible or didn't know what route to take to apply for long-term services and supports. But the reality that I think I've shared in previous meetings is that people are referred to hospice way too late in their illness. So they may have already qualified for state funded long-term services and supports, or they may be getting some long-term services and supports in their home that they're paying for privately. So in that situation, we haven't talked about that. Long-term services and supports that I believe we're talking about today are all the state funded long-term services and supports. They're not the private pay long-term services and supports. So if someone is able to stay in their home and pay for that to happen, I'm not sure that they would qualify. Is that accurate, Mairead?
That would be an individual state decision if we're supporting people, which I lean towards, if we support people by their level of need and not financial. I would prefer to anyone who's at that need, because I don't think advocacy changes by payer source.
I agree.
So
I agree. I'm just not sure how they're looking at that at the
Yep.
federal level. And I think that's important because there are many people that are actively, their goals are to stay at home, and maybe they have the means to do that. So they're paying people to support them in the home.
And we want to encourage that, right? We want people to
Right.
stay, or we want to not even stay home. I want people to be in the setting that best supports them and they feel the most supported. And
Right.
in the nursing, I'm just thinking out loud now, so bear with me. In the nursing home and in an assisted living and a residential care home, we offer support to all individuals regardless of payer source, right? It's regardless of payer source. It's by the fact that they need long-term services and supports. That is a model where, as a state, we only support people in the community that actually have a financial need, although we want people to spend down and use their money the way they best see appropriate. I would lean towards supporting anyone who has an LTSS need, regardless of payer source, as long as they're staying in this, they're choosing. Yeah, so I would lean towards that because we do that in institutional settings now. It is regardless. That's actually in our thing. It's regardless of payer.
Well, then I think in that case, those are questions that need to be brought forward to Wisconsin and DC as well, because that really expands the population that might qualify for any kind of ombudsman support. And then Melissa, the rest of those that are referred to hospice, which is a sizable percentage, have never received any long-term services and supports in their home prior. So I don't have an exact percentage, but I can tell you that there are, significant numbers in that regard as well.
Thank you, Tracy.
Thank you. I do recognize that there are so many populations that there is a need for them. We certainly don't want anyone to be falling through the cracks. And I do think that we do need to continue to study that piece for sure. And my sort of thought process is that, we put together a bill that would have a task force that would look at those other items, or another working group like this. And would love to hear from folks who are interested in discussing that piece. But I think within the short session, I think it is going to be a challenge to get all of this over the finish line. And I do think there is quite a bit of work that needs to be done for all those pieces. And I'm hoping that I have support from people in this community here of our discussion to carry on that discussion. Representative McCarty.
Yeah, thank you very much, Representative Dathan. And you just hit on, I was going to try to ask the group, in really reflecting just on your comments just now, as we're going through these discussions, we're learning there are lots of unknowns, lots of pieces to it. And it's a new initiative by this working group to bring forward to the state, but we are in a very short session going forward. And so I do concur with you that there's a lot more work that needs to be done to get this right. We've all, I think, come to the consensus that we don't want to leave any gaps. We want to be sure that if something like this is initiated, that everyone can be covered. I think you, Representative Dathan, then focused in on, well, could we do this in a phase-in sort of approach incrementally, and begin with at least putting a task force together with a mission as to where we're going to go, and then to look with this group and to the experts who deal with this every day, find out if they think there's a piece there that we could begin almost in a pilot type of a program to just see how it could unfold going forward. I think we've determined that there's expanding the Ombudsman program is a good idea, and to try to meet everyone's needs. And this group is focusing in on hospice care. I'm trying to understand it myself. Just what could we do coming up in this session? What would make sense, and how we could proceed? I think we've all cleared that it's a big undertaking, and we still need more information. I did see there were a couple of other states. I don't know, Mairead may know more, but I looked at Vermont and Ohio seem to have ombudsman programs that reach out to all, almost like the money follows it's determined by person-centered long-term care services throughout. So I think there's more work to be done, but I'd like to see us begin something this session so that we don't lose any momentum, and that we can focus in. So I'd be interested in hearing from the experts on the call what they think could be done at this coming up in this session. Thank you.
Thank you, Kathleen. I think that's great. Does anybody want to comment on that before I go to Anna's question? Or Anna, is this part of the discussion that Rep. McCarty brings up?
Yeah, I think it's related. I hope so.
Okay, good. Well,
so just in terms of, very concretely, what can we do in, a short session without a lot of money? Like, how can we target a particular population? I wonder, Mairead, maybe this is a question for you. But what happens to that money follows the person population, because they receive representation, through your office when they're in a long-term care facility, but then when they transition into the community, do they lose the ability to access your services? I mean, because that's a relatively finite number of folks that receive services in the community, but it's folks who, I'm just wondering, could that be a starting point for some kind of pilot program?
Representative, is it okay if I answer that?
Sorry, yes, please. I was waiting for sitting on the edge of my seat waiting for your answer.
So I think that is a potential first approach, is to look at individuals. I would say there's so many programs outside of MFP that are moving forward. There's CHESS, there's My Care Options, there's all these things. Maybe it's anyone transitioning out of a nursing home for the first year to study, with the commitment to grow from there to other people receiving LTSS services. So we get a baseline and we can kind of, I want to make sure if we're doing this, we're doing it well, right? And that we have the opportunity to get the staff in place and a team. Like we've talked about this a lot. We have a basic framework in mind, but again, I don't want to take on so much that it's not implemented well and we don't see the success in it. Representative McCarty brought up Ohio. So interestingly enough, the Ohio State Ombudsman resigned a month ago to become our ACL director for ombudsman programs. And she is the person that has been hosting these conversations related to community ombudsman because of her experience in Ohio. I will say that part of what she shared is that, and I think Melissa brought it up earlier, they don't feel that they've had as much use of the community ombudsman in Ohio because they didn't publicize it, right? It was a resource there for people who knew about it, who either came out of facilities and then used it, but they didn't do a big push to publicize it. So in that way, it didn't get as much use, which I believe is something our program has struggled with over the years, not having the ability. And I will say, since changing our in the past year, I've changed our strategy on publicity, and we now have other languages. We use radio, we use TV, we use all kinds of stuff. I feel like it has increased our volume of calls. So when people are educated on something, I think they'll use it. So I would lean towards that, putting it out so that when people transition out of a nursing home to any setting, as long as they're receiving their LTSS, giving them the information on how to stay in contact with us. And I truly believe in the regional teams and that warm handoff so that they have consistent people, trusted people. And that's when we see good use of our program as well. When they may go to 2 or 3 different nursing homes in the area or be in an assisted living and then a nursing home. When the same person shows up that they have trust in, or they know it's part of our team and they've met them before, we have better outcomes.
I agree with you, Mairead. I think, anything that we do, we need to ensure that funding is in place for this sort of marketing, public education, really be kind of getting the message out to folks so that they know where to go. It is vital to the success. And I think, again, Melissa brought that up early in the meeting. I would like to make sure that we continue to remember that. Diane, would you like to ask your question?
Yes, thanks. With Representative McCarty, thank you for your comments. I've concluded, of course, there's much more work to be done, data gathering, because there hasn't been a lot of as much outreach and publicity. The numbers really are not credible because we just don't, and what I'd like to see in this short session, number one, is that in a bill that it mandate a publicity strategy that includes hospice, or that at the very least, and this is very inexpensive, there already are several, for instance, the Attorney General number that Dorian mentioned, but there are other things people can know, I'm sure from Mairead's office, that has to be a part of this session. It is not, it wouldn't have a large fiscal note, especially since we will be getting some money and maybe already have gotten money from other federal programs. And if we don't get money for publicity, that's why I suggested, I know no one has mentioned any, that we look at, what the fees are. And I'm not suggesting raising them by a lot of money, but enough money to pay for publicity, at least. Enough money to pay for someone to answer the increased phone calls in Mairead's office. And those would be limited expenses, but important expenses. If we don't at least have that, then I'm opposed to us starting with long-term care people transitioning to hospice, because that totally bypasses a lot of the people I'm here representing whose, parent or their loved one were not in long-term care settings. They were ill, and then it was decided that they, stay at home. It didn't work out, and then they chose hospice. So it totally would bypass the experiences that I'm bringing to the table here. I've become almost allergic to the phrase pilot program, because I do a lot of advocacy on environmental issues and renewable energy issues, and the states go to a lot of the time is, let's do a pilot program. And the thing is, I think that we know enough that we may not need to do a pilot program. We just have to get funding to added people and possibly change of Mairead's office so that we could list specialists such as hospice, such as home care. I just don't think doing it through the long-term care system is going to handle my concerns. That is not why I'm here. I want to just lastly say is that those programs are in place. There are problems with long-term care, but I would expect that there's funding for those to reinforce and enforce long-term care issues. There is nothing yet for the setting that I have brought to the table here, which is home-based stuff that came not of long-term care, but just where someone became ill, they're in their home, then they go to hospice. I think that, not to disrespect all the good work that people do in long-term care settings, but there are laws in place, there are problems there, there's funding needed, yes. But that is why I mentioned last time mission creep, because now the very reason we were here is now kind of being set aside and wait till next year. And I say we can't wait. And this is something in my work as a former regulator, the federal government, sometimes they're allergic to changing needs. And from my understanding, hospice and home health care has exploded. And all the people that work on that need our support now. And it means that people aren't in long-term care. They just were in their home and they need the support. So thank you for hearing me out.
Diane, I agree with what you're saying. We do need to make sure that no one's left out, and we need to think about this. And when I'm describing kind of a phased-in approach, I'm not really saying that we do a pilot program or we do something and study it again. What my suggestion is, and I'm going to let Mairead comment as well, but my suggestion really is, my concern is expanding the home health care and community care to such a large thing that it just becomes almost too expensive. And so when I kind of talk about expanding the current ombudsman program, and I would like to see this done in this session, and I'd like to look at legislation. One who's really dedicated to investigating the long-term care facilities. Obviously, money follows the person. So if that person then transitions home, then that money would follow the person, rightly so, and they would still be able to contact Mairead if needed. But because, we want this to work in a non-siloed way, and I think, keeping it within that sort of current ombudsman structure, so that we can make sure that, that there is adequate communication, I think is super important. But I do believe that we need, someone who does deal with, like you raise people who, haven't been in a long-term setting and have been aging in place and all of a sudden find themselves at the end of life, which we all will at some stage. But that is also caught up. And I don't want you to feel that we're not listening to what you're saying here, but we're also saying that and when I say phased in approach, I'm thinking looking at some of the other areas of home care would be the sort of phased in approach, and kind of tacking on to the current program, but doing that in a phased in approach, and really focusing on the home care, especially as it relates to ombudsman. Mairead, do you want to comment at all before I jump back to Melissa?
Sure. I just think that there are some ways that other states have supported quality assurances for individuals receiving long-term services and supports, no matter what that is. But one of them is really, there is a match, right? Federally, when a person, it's a benefit to the state when a person chooses to receive their long-term services and supports in the community versus a nursing home. And part of that match in some states is used for that to support a quality assurance program, a small amount of it. So if it's 50 cents, maybe 5 cents for every dollar goes towards that. And it's the way to supplement what is already there through other resources. So that's one way that it can be done. But as far as the roll-in, I would see, again, hospice. I don't know many people, I'm going to say this broadly and make sure I'm saying it right. I don't know many people that are receiving hospice services that do not qualify for needing long-term services and supports. So Tracy, nod your head if I'm getting that wrong. Like, I would think if someone was at a level where they're needing hospice, they would qualify for needing LTSS. Jennifer, like I just couldn't see a situation where someone like, oh no, they don't need long-term care. They're just on hospice.
Well, it purely depends on the individual and the family situation and who's caring for them. Some people.
No, I just
family.
mean purely. Yeah. Not that they are getting it or not that the family can't do it and things like that. But as far as.
Oh, have Mary's just joined. She's a social worker from hospice. Let her respond.
Yeah,
if that's okay.
I might be able to speak to that. I think we're getting more people that are connected with palliative care as well. And so they're transitioning onto hospice, unfortunately, as Tracy said, with much shorter lengths of stay, but they are being identified on palliative. And so they can certainly benefit from the long-term supports and services while they're on palliative too.
Yep. Even if they're not asking for them, that it would qualify for them. So that's my point, that the individuals that I think you're talking about, Diane, and wanting to serve would be part of that catchment. To Tracy's point, the people that I don't think we would be starting off serving or jumping right into is someone who might choose to have their a hip replacement or a knee replacement and is at the hospital, and then they discharge home on home care services for rehab, for wound care. That would dilute us to the point where we wouldn't be effective, I think. And they don't need long-term services and supports. They need that sort of short-term support to get back to their way of life. So if down the road we were ever going to support that person, I would want to see that way down the road and have this be our opportunity to support the people that needed more of those long-term care supports.
fully agree, Marie. That's kind of what I mean by kind of phased in. We can kind of look at it as, and I think that it still needs some more work to figure out where do we sort of draw the line when it comes to some of these things. And I think you've raised some good points there. So thank you so much for everyone. Melissa Morton, you have your hand raised.
Yes, thank you. I'm wondering if we're not getting ourselves to a point where it's time to actually put pen to paper and define the populations that we're talking about, both a global goal of someday, what would we like the Ombudsman program to be able to cover, and then back out of that into where would be a reasonable place to start. If this is the universe of populations that we would like to someday cover, where do we then start? And I also think defining some key terms for this group would be helpful, because I think we get very tripped up sometimes in just how different people are defining long-term care. And it's important to remember that I think those of us working in the industry, when we are saying long-term services and supports or long-term care, we are always referring to the community as well, that it's a continuum. So we aren't just focusing on long-term care in a facility, but are keeping in mind those folks that are receiving long-term care or long-term services and supports in the community, and then might be going to hospice. And I think even within that home care population, we have, as Maritha already said, we need to prioritize long-term services and supports versus acute care, acute home care. But also we need to look at, to Tracy's point, that we might need to even further tease out as we look at funding those folks who are private paying for their home care services versus those who are on a public program. And so I just think it's because we are talking about such a broad universe and we all have different ideas, it might be a good idea to start to really flesh out the end goal and then see where we start to incrementally phase in.
Thank you so much. That's a really great point, Melissa. And I do think that that's part of the exercise as we go through and kind of develop legislation. Representative McCarty.
Thank you, Representative. Yes, I very much appreciate Melissa's comments, because I think she pointed out when I made my initial comments a few minutes ago, I was including home care and long-term services. So I think that's an important distinction. We do need to look at language to be sure that everyone's understanding exactly the population that we're referring to. I think we did all agree that as we do, if we were going to expand the Ombudsman program, we don't want to leave any gaps. And we certainly understand there's so many different streams coming in for funding and all kinds of variables there. But I appreciate Melissa's comments about looking at the big picture and then agreeing with you, Representative Dathan, what is feasible now and what can we do going forward in this session that would make sense. And I hope Diane would forgive me, but I am totally opposed to adding any additional fees on to the providers coming in. They're suffering enough already with funding, and I certainly don't think that's an area that we would want to, at least for myself, I wouldn't like to put added funding onto any of the fees, but we could find some creative ways to look at where funding sources would come forward. But I, again, defer to Mairead and Tracy and the people that are actually in this field doing the work currently. They could guide us on how we could move forward next session with something that shows the interest of this working group to expanding eventually the Ombudsman program to meet all the needs of everyone in the community. But we, as you said, Representative Dathan, understand that that's such a very vast undertaking that I don't think it's possible in this short amount of time to get all the answers to the questions that have been posed. And so we need to see what we could feasibly do going forward next session. And I think your approach to trying to focus, but then, I want to be careful because equity is such an important piece in today's topic in every area. So we want to be careful how we propose it and to be sure that it's a step trying to get us to the next step. If you understand what I'm trying to say. Excuse me. Sorry, thought my phone was off.
Don't worry, I like your
so maybe Mairead and Tracy could help us figure out just what we could do as a working group. And I know we get pushback on task force, but I think this is really an area where we're going to need a lot more information going forward. But I don't think, even though we're lacking some information, it doesn't mean that we can't start the process. So that's just, I think, where I stand at this. It's confusing.
Yeah, I think that's good. So does anyone else have any further comments? I know there is a little bit more work to do. And I do think that we have a little bit of time before session starts in February, but when session starts, we need to get going. Tracy, I'm gonna call on you, sorry.
I'm sorry, I didn't mean to do that in the middle of
No, you're fine. Right.
The only other thing that I want to make sure of is depending on what we decide for initial steps, I think Dawn Lambert really needs to be part of this conversation because she's the one that leads the whole rebalancing piece with Money Follows the Person and all of the additional programs that Mairead was referring to before. We have Jen at the table, and I think having Dawn here too would really help us just determine the numbers, the workload, what's doable.
Yeah, absolutely. I think that's a good point. And, getting involved and kind of looking at exactly what the legislation would entail, and to make sure that anything that we do does include funding for continuing to promote and outreach to our community, outreach to the members of our state, and getting that education piece out there. That has got to be critical because we can sit here and create what would be an ideal structure, but if people don't know about it, it really won't be able to help anybody. So that's kind of the key point, in making sure that Mairead has the tools that she needs to do the outreach to make her office more effective. And then also, as I touched upon earlier, I want to make sure that whatever we do, we don't create silos and we are able to work together, communicate together. And so that people who maybe have not used any long-term services before and coming in new to this know where to reach out to, because it might not be super logical to every single person. So I think that's an important piece. So my view right now is that talking about, the sort of phased-in approach, looking at what else outside of the sort of hospice care could be part of a working group, and then looking at raising a bill for this session that deals a lot with the home hospice program and that what that would entail. We all know that this is about the money. We had at that sort of report that I issued, sent across, it was the 1918 piece of legislation that talked about the 2.2 million to set up this. And so that is something that we need to look at. We want to make sure that we get that through. I know Representative Abercrombie, who is Chair of Human Services, and myself both sit on appropriations. So that's something that we can kind of keep a look at. and she is chair of the Human Services Subcommittee. But whatever we do, we'd like to make sure we work with Representative Fitz and figure out where the sort of best home is to raise this bill, and that we talk to aging, because that is an aspect of this as well. So there is, a little bit of work to be done in that. And my view is, I think this working group has been great. I think we have made a lot of progress in the last sort of 5 months, and I really appreciate everyone's involvement and thought process. And I think we still have a little bit to do before we have our final legislation, but I think it's given us a lot of sort of food for thought in preparing what potential legislation would look like. And I know we will have continuing dialogue over the coming weeks before session starts. I'm going to open it up for comments. I'm going to start with my co-chair, Representative McCarty.
Thank you very much. So I just want to be clear, so I understand a little better where this working group now, where do we go as we're going forward? Because I think you had mentioned in one of the communication that this was the last working group meeting. So how will we get the information back to the working group as to what we might be putting forward going in the short session? And then if I may just take the privilege thanking Tracy and Mairead, I didn't mean to single the two out. I did mean all the professionals that are working, that we need their input and their guidance moving forward. And then we need to be creative on looking at the funding sources going forward. And I know you and I will have more discussions after today, but just clear for the group as to how we're going to get information back to the working group and our timeline. Thank you.
Thank you. Yeah, I was going to jump into that next. So it is the sort of last working group session that we have booked in. We do have an amazing administrator, Heather Ferguson-Hull, who's been keeping us in the loop with everything. So she will put together a sort of description and kind of notes from today's meeting. She will circulate. And, I'd like to sit down with our sort of legislative experts and kind of talk about how we can craft potential legislation, thinking about what is working, what we need to be considering, and then also thinking about what we would want this task force to focus in on. So I'd say actually two separate pieces of legislation. And this task force really focusing on some of the points that you've raised as well, that we need to do some more work on, whether it's a task force or a working group or however we structure it. In my opinion, I think this working group has done a lot of great things, and I think in some ways it's been it's been very efficient, more than other things. But I do believe that a major expansion and some of the things that we've talked about is just too big to undertake in this special session. But I do believe incremental work and working on the smaller increase, for at least in the short term, and working with Mairead is the right solution for a short session. And so my view is we will continue to carry on at least an email dialogue. If we get to a stage in January, I'd love to get the group together again and get the band back together and have a further discussion before we jump into special session. But I will keep the group up to date on where we are with things, so it's not a surprise when session starts and we have something. I think the reason this work group has worked so well is because there's been a lot of communication, and I think we need to carry that on. but whatever, you know, the final piece of legislation looks like and where it's sitting, I think, there is going to be some iterations, but I'd like to, keep the group involved via email and communicate, and possibly I'd love to follow up with some of the other things and what's happening in other states that Mairead pointed out, and have those discussions. Rep. McCarty, does that answer your question?
No,
and how does it come to you?
Yes, it does very much. And I appreciate your comments, Representative Dathan. If I may just, and I know I don't want to take too much time, but Mairead has been working very hard in building up the volunteer resident advocates with the long-term care that pointing out the difference here. If we expand the Ombudsman program out eventually and covering all, can she maybe look into, I'm sure there's some legal ramifications for having volunteer advocates in a broader Ombudsman program meeting home care needs. And I'm just curious if we could add that topic, trying to see whether volunteer advocates, are they in the other states working in home-based community settings as well? Because I know the program, and again, to Mairead's credit, she's been working very hard to build that up. And I think they're so valuable in the long-term care setting, but I'm having a little trouble trying to figure out how it could work in a home care, which is such a much larger expansion of individuals. So it's just excuse me for delaying, but I think it'll be an important point to look at as well as we go forward. Thank you.
That's a very important point, and thank you for raising that. And I'd love to hear, Mairead, what your sort of feedback is on that.
Sure. So in some states, the programs are very much supported by their volunteer base. I think the difference from what would be a traditional volunteer, as we just did our annual volunteer wrap up yesterday. Here for our program, they have to be federally certified. So yes, they have training monthly, there's things they have to do, but we could use it in this setting, but they're a very specific type of volunteer with lots of training, oversight, and certification.
That's great. Thank you for answering that. I know folks at home are probably wondering that as well, so thank you.
All right, and if I may, Representative Dathan, I do think the volunteers are also specially trained in hospice care as well, so that we can zero in on a little more as well. Thank you.
Yes, super important that they have the relevant training and everything. Hospice is such a unique skill set, and we want to make sure that people who are involved with the program have been adequately trained and have that sort of knowledge base, and also have the kind of community around them that will facilitate the so that the best outcomes for all of our patients in this sort of time of need and final hours is there. So thank you for raising that. Does anybody have any sort of final closing comments before I adjourn for today? No. Oh, Diane.
Well, I wanted just to say thank you to everyone. And I really do appreciate Tracy's adding information and pointing out a whole group, the private pay area. That's very important. And I think it sounds like for a task force or a continued working group, getting of course, I know it's the intent of this group and you, Representative Dathan, to get the data to be more reflective and finding ways to do that with the help of all the agencies that collect data, even including maybe changing. This is something that could be added because it's a low cost for this session, and that is adding select questions on the review forms or inspection forms of certified providers that ask the question about the complaints or issues. I'm looking for, with you, low-cost ways to get started in providing better data. And lastly, I just wanted to wish everyone a happy holiday and a safe one. I guess I want to make sure we have that sense of urgency, because the home-based healthcare and hospice care are exploding, and the folks that work in that business need support, but so do the families of the people needing a place to ask questions. I lastly just wanted to ask, assuming the Build Back Better money is coming, is there a way to assign some of the money to immediately get Mairead's office an additional lawyer or investigator, or at least answering the phone, so that we don't have to wait a whole year? And even though those monies are finite, it would be at least a year or two. And by that point, I have good faith that in the next long-term session, the legislature would have more funding suggestions. So it would kind of be a money bridge to get this going faster, because of the sense of urgency I think that is called for. Thank you.
Important points, Diane, and I appreciate it. We don't have a final bill on that yet, and as Maureen's pointed out, the community ombudsman is currently in the bill, but we all know that legislation can change anytime throughout the process. So she's following it closely, and we've been having an ongoing dialogue about that. In regards to just allocating money, unfortunately, that does have to go through the legislative process and the appropriations process. Because this year is a short session, the primary focus of what we're doing this year are budget-related items and budget adjustments. Representative McCarty also sits on appropriations with me, so this is something that we're going to be looking at and thinking about going forward, and when we can get this money out there and utilizing and supporting the families, the workers, and how we can make sure that what we're doing is appropriately done. So, but it does have to go through that process, which unfortunately, for good or bad, it does take some time. But the good part of that is that we have the public discussions. And I do think that, I always, I'm kind of going to bring back to where we were talking earlier today, is we do need to have, folks like yourself, anybody that has concerns over budget items, to make sure that they have their voices heard. They advocate as part of the public hearing process. If something's important to you, you want to see, this is your taxpayer dollars, whether you want it to be in a certain, going towards certain things or not, having that voice and that public support in terms of testimony is vital. And I know, Diane, you're very active. I've seen you at the Capitol many times testifying on various pieces of legislation over the years. And it is very vital, and want to make sure that folks out there know that your voices are important to us legislators. And I'm sure Representative McCarty goes through, just like I do, all of the testimony when we're thinking about different pieces of legislation. It is an active part of our involvement in evaluating what we're doing. So I hope that continues to happen. If there is nothing else, I'd like to adjourn for today and say again, heartwarm thank you to everybody here. Even if you've not been able to make every single meeting, your voices have been so important to me, and appreciate the work that you've done also behind the scenes and trying to do the investigations for bringing data to this group. It has really been really vital, and I'm really appreciative. I hope everyone has a wonderful holiday season ahead of us, that you get to be safe and healthy, and ensure that you get to celebrate with the people that you love. And Representative McCarty, I'm going to let you speak.
Thank you, Representative. I just wanted to recognize you and thank you for coming forward with this working group and helping us. And it's always hard when the leader, so I just wanted to take the time to thank you and recognize you, and to also wish everyone happy holidays and a Merry Christmas. Thank you.
Well, thank you, Representative. This is so important that we work on this, and I do think that this working group has been invaluable to me, because I've thought so much more about this legislation than when we first started talking about this a year ago, Diane. So I think it's moved, and I think it's moved in a way that's going to make it more successful. So that is the end goal, is to have successful bits of legislation. And it's great to have partners like Representative McCarty who want to roll up their sleeves with me and try to work through and find good solutions for the residents of our state. So with that, I want to thank everybody, including Mairead. It's been great to have you on board and all of your knowledge, and you have done so much work. Jennifer, you've done a lot of great work. Thank you for all your work. Tracy, it's always lovely to have you on the call and asking the right questions. And to everyone else, Dorian has been great, and hearing from Mary and Melissa and Teresa have been phenomenal. So thank you, everybody. But I do want to if everybody can give a big round of applause to our administrator, Heather Ferguson Hull. She's been absolutely amazing for the last several months, keeping us organized. And she has assistance from Christina Penge, who's been also helping her as well. So heartwarm thank you to all those folks. And I hope you have a wonderful rest of the year. And please don't feel worried about reaching out to me. I'm happy to jump on a call and carry on this dialogue. There is work to be done, and but I think we've made a lot of progress. So thank you again, everyone.